Magandang araw sa inyong lahat and welcome once again to another recorded lecture for the subject Concepts in Pediatrics. In today's lecture, we are going to cover a very important topic, which is newborn assessment and physical adjustments during delivery. You have to remember that after birth, the transition from the intrauterine life to the outside environment is a significant adjustment for the newborn, and it is crucial for us healthcare providers to understand how to assess and support these changes in the newborn. By the end of this session, you'll be familiar with the key elements of newborn assessment and the physiological adjustments a newborn makes during and after delivery. So let's get started. Bring out your handouts and your ball pens so that you can follow along our discussion. After delivery, newborns typically experience what we call physiologic weight loss within the first 5 days of life, which accounts for about 5 to 10% of their body weight. This is actually a normal occurrence and this should not be a cause of worry, and there are key reasons behind this early weight loss of the newborn. Number one is that while in the womb, the newborn is under the influence of maternal hormones, especially those that can cause sodium and water retention. Once born, the baby no longer receives this hormone, which leads to a natural reduction in their fluid retention. And that is the reason why newborns experience weight loss in those first days of life. Aside from that, there is already increased elimination, meaning the newborn already starts to void or urinate, and they already start to pass stool or defecate. And now this will also lead to further weight loss because of the loss of fluids, which will contribute to their weight loss during the first 5 days of life. And the last reason why newborns will experience physiologic weight loss is the fact that there is low calorie intake in the first few days of life. You have to remember that in the first 2 to 3 days after birth, the newborn's intake mainly consists of colostrum, which is the first breast milk produced by the mother. This is actually rich in antibodies, but this colostrum is low in calorie. And this low caloric intake can result in a slight weight loss until the mature milk comes in. So this weight loss is typically regained by the end of the second week. Huwag kayong mag-alala kasi babalik din po yun, and the child will already regain this weight loss pagkatapos po ng 2 linggo, assuming that the baby is already feeding well. So we have to monitor the newborn's weight and ensure adequate nutrition through breastfeeding or formula feeding, because this is crucial to ensure that these newborns will regain their lost weight, or what we call physiologic weight loss. So again, let us look at the reasons why there is physiologic weight loss. The first reason is that the newborn is not anymore under the influence of maternal hormone, which is sodium and water retaining. Aside from that, the newborn already starts to defecate or to urinate during the first few days of life. That's the reason why there is a slight weight loss. And lastly, there is already the intake of colostrum, and colostrum, or the first milk produced by the mother, has low calories. That's the reason why newborns will have slower rise in their weight during the first 5 days of life. One of the major changes that occur in the fetal to neonatal transition is the changes in their circulatory system. The transition from fetal to neonatal circulation is a crucial process that occurs immediately after birth. Agad-agad po yung nangyayari. In the fetal stage, the developing baby relies on the placenta for oxygenation and nutrients. And during this time, the baby relies on the placenta for oxygenation. The oxygenated blood from the placenta is supplied to the fetus through what we call the umbilical veins from the placenta, and this blood contains high levels of oxygen, which is essential for fetal growth and development. During the fetal circulation, kung naalala nyo pa, there are shunts, or what we call accessory blood vessels, that allow for the circulation of the fetal blood to the placenta and to the fetus's body. There is what we call the ductus arteriosus that connects the pulmonary artery to the aorta, allowing the bypass of blood to the lungs. There is also what we call the foramen ovale, which is an opening between the two atria of the heart, which facilitates blood flow directly from the right atrium to the left atrium. However, when the newborn is born, the fetal circulation will already change to neonatal circulation. When the newborn takes its first breath, kung siya po ay nakahinga na, and when the umbilical cord is clamped, dito na po nangyayari yung ating shifting from fetal circulation to neonatal circulation. I repeat, once the umbilical cord is already clamped, the blood flow from the placenta already ceases or stops. And this prompts the newborn to initiate breathing and to establish oxygenation through the lungs. So, lagi nyo pong tatandaan, with the onset of breathing, kapag yung bata po ay huminga na, when the child already initiates breathing, the lungs expand, causing a decrease in pulmonary vascular resistance. And this change will allow more blood to flow into the lungs for oxygenation, which was previously bypassed in the fetal circulation. Lagi nyo ding tatandaan na apart from the shifting of the center of oxygenation from the placenta to the lungs, nagkakaroon na din po ng mga closure of these accessory structures. The first vessel that closes when the baby already starts to breathe is what we call the ductus arteriosus. Now, this vessel constricts and eventually closes, typically within the first few days of life, redirecting blood to the lungs instead of the aorta. Ang isa pa pong nagko-close dito during the breathing of the child is what we call the foramen ovale. Now, the increased pressure in the left atrium due to the enhanced blood return from the lungs will cause the foramen ovale to close. And over time, this structure change leads to complete closure of the foramen ovale, usually by the end of the year. So, lagi niyong tatandaan na nagko-close po yung ating ductus arteriosus at yung ating foramen ovale when the baby already starts to breathe and ventilate their own lungs. So, after these changes, the neonate circulatory system becomes fully established already, with blood now circulating to the lungs to receive oxygen and then being pumped to the rest of the body through the heart. Now, the typical path of blood flow includes, number 1, there is oxygenated blood returning from the lungs to the left atrium, and then flowing into the left ventricle, and then pumped to the aorta to supply the different parts of the body. So yun na po yung mangyayari. So there is a shifting from fetal circulation. After you clamp and cut the cord, the child will already start to breathe, and when the child already uses his lungs, magko-close na po yung ating ductus arteriosus and the foramen ovale. So that will now start the shifting of the fetal circulation to neonatal circulation. Yaman din lamang na napag-uusapan na din po natin ang dugo, we also need to assess the newborn's blood values after birth, because understanding the normal blood values in the newborns is essential for assessing their health and identifying any potential issues. So let me give you an overview of the changes that occur in their blood values, including their blood volume, white blood cell count, and even blood coagulation. So pag-usapan muna natin yung blood volume. You have to remember that the normal blood volume for newborns is approximately 80 to 110 ml per kilogram of body weight. Ganun lang po kadami yung dugo ng mga bata. So for example, for an average newborn weighing about 3.5 kilograms, this equates to just around 300 ml of blood. Ganun lang po kadami yung dugo ng ating mga newborn babies. Now, what is significant about it? Adequate blood flow is crucial for maintaining circulation and ensuring that oxygen and nutrients are delivered to the tissues in the body. Now, lagi nyo ding tatandaan that there is also changes in the white blood cell count of the neonate. The normal white blood cell count for newborns is around approximately 15,000 to 45,000 cells per cubic millimeter. Now, always remember that this elevated WBC or white blood cell can be a non-pathologic increase due to the stress and trauma of birth. Di ba nga ang sabi nila, tumataas ang WBC or the WBC increases if there is infection. But you also have to remember that there is also a non-pathologic increase in the WBC, and this is just because of stress or trauma of birth. Now, bakit mo, sir, binibigyan ng diin itong topic na to? You have to remember that it is important to note that this can complicate the assessment of infection, as a higher WBC count might mask or confuse the signs of true infection. Kasi nga po alam natin na tumataas ang kanilang WBC kapag may infection at mataas din yung kanyang WBC kung sila ay na-stress lang at birth. Now, when we look at the WBC of the child, it will be very hard for us, nurses and other healthcare providers to determine kung ano yung totoong rason kung bakit tumaas yung WBC ng bata. Is it because of an infection or is it because just trauma of birth? So lagi niyong tatandaan po ha, there is a non-pathologic increase in the WBC just because of the stress or trauma of birth. Now, pag-usapan din po natin yung blood coagulation. Blood coagulation is also known as your blood clotting, and it is a vital process that prevents excessive bleeding in neonates. Ano ba kasi yung role ni vitamin K? We have already previously discussed this. Newborns have poor blood coagulation because of low levels of vitamin K, which is essential for the synthesis of clotting factors. Saan nanggagaling si vitamin K? Vitamin K is synthesized by the intestinal flora, which newborns typically lack due to their sterile intestines at birth. And because of this deficiency, this can lead to increased risk for bleeding, or what we call vitamin K deficiency bleeding. So what do? We have to monitor these blood values in the newborns because this is crucial for identifying potential health issues. Now, understanding the normal blood volume of these kids or newborns, their WBC count, and the role of vitamin K in coagulation will help us healthcare providers to ensure that these newborns are stable and healthy during their early stages of life. We have to properly manage these newborns, including giving them vitamin K, because this is essential in mitigating risks that are associated to bleeding sa ating mga bata. Apart from the circulatory system, there are also significant changes that occur in the respiratory system in neonates after they are born. Lagi niyong tatandaan that the respiratory system undergoes significant changes at birth as the newborn transitions from the intrauterine life to the extrauterine environment. And this transition is critical for ensuring adequate oxygenation and requires considerable amount of energy in the pediatric patient. Mahirap po ang paghinga ng bata, especially on the first time. Sir, bakit sila nahihirapan, or why are they hard up in transitioning from fetal circulation to neonatal circulation, or why is it difficult for the child to breathe once they are born? Lagi niyong tatandaan that the first breath of a newborn is a crucial event that requires substantial amounts of energy. And this is primarily due to the sudden shift in the center of oxygenation from the placenta to the lungs. So na hindi po kasi sanay yung bata na ginagamit niya yung kanyang lungs sa paghinga at mas sanay siya sa placenta. And because of this, because of the sudden shift, nahihirapan po yung baby na i-activate yung kanyang lungs immediately at birth. Okay? Aside from that, we also have to remember that there is a presence of fluids in the lungs of the child. Yung mga nalunok niya na amniotic fluid, they are still lodged on the lungs of the child, which needs to be cleared out first to allow effective air exchange and breathing for the child. So imagine, punong-puno po yung lungs ng bata ng secretions, and that will be difficult for the child to initiate respiration. Now, for babies who are delivered through normal spontaneous delivery, the pressure exerted during the vaginal birth will help force out these amniotic fluid and other secretions from the lungs. Dahil nga po pag lumabas yung bata sa vagina po, napipiga yung chest ni baby, and that will facilitate the secretion and the removal of this amniotic fluid from the lungs of the child, making it easier for the child to breathe. So, okay, so lagi niyong tatandaan, the pressure from the vagina will facilitate the clearing of fluid, which will allow for quicker absorption of the lung vessels of these fluids, which will also help establish the normal respiration function of the child. Now, in contrast naman po sa mga NSD babies, yung mga CS babies po natin, or the babies delivered via cesarean section, they may face difficulty in establishing respiration. Bakit po? because fluid is not expelled thoroughly due to the lack of pressure that occurs during vaginal delivery. So during CS kasi, hindi naman napipiga yung kanyang chest because of vaginal delivery, kaya hindi din na-facilitate yung removal of these fluids during the CS. And as a result, these newborns may have difficulty initiating their first breath, and the excess fluids in their lungs can block the air exchange space in the lungs, which will hinder their ability to take in oxygen efficiently. So sir, ibig bang sabihin niyan yung mga batang CS po, mas mahihirapan silang huminga? Definitely opo. Mas mahihirapan pong huminga yung mga bata na CS po because also of the effects of the anesthesia. So always remember that the respiratory adaptation of newborn is a complex process that is influenced by their mode of delivery. And yung mga bata pong pinanganak via vaginal delivery or NSD, mas mabilis makakahinga kumpara sa mga bata pong pinanganak via CS. Bakit ko dinidiscuss sa inyo to? Because understanding these differences will help us, healthcare providers, to recognize potential difficulties in breathing and will allow us for timely interventions. So for vaginal delivered babies or for babies born via NSD, the natural expulsion of fluids will support effective lung function, while in cesarean section babies, they may require additional support to clear excess fluids and initiate breathing successfully. So at least pag kayo po ay nagkaroon ng mga pasyente na masi-CS, alam nyo na po that you will have to watch out for difficulty of initiating breathing sa ating pedia patients because of these factors. So proper monitoring of respiratory efforts immediately after birth is also one of our essential responsibilities to ensuring optimal outcomes in the newborn care. Still on the topic of respiration, let's talk about surfactants because this is a topic that you, future healthcare providers, should know and be aware of. Now, ano ba kasi yung significant role ni surfactant in the newborn's respiratory health? Surfactants are essential fluids that are located in the lungs and they play a crucial role in the process of breathing, particularly in the inflation of the alveoli. Ano ba yung mga alveoli natin? These are the tiny air sacs in the lungs and they are the main unit of respiration. So let's look at what surfactants are. Now, surfactants are primarily composed of what we call lecithin and sphingomyelin. Ito po yung mga surfactants natin. And these substances will help reduce surface tension in the alveoli, which prevent them from collapsing during exhalation. Kasi kung wala po tayong surfactants, mabilis pong sumabog or masira yung alveoli ng bata kapag siya ay humihinga. Now, it is very fragile. The alveoli will be very fragile without this surfactant. And when the child breathes in, if they do not have surfactants, their alveoli may collapse. Okay? For a lung to be considered mature, there should be a lecithin-sphingomyelin ratio of 2:1. You always have to remember that, na dapat may dalawang lecithin and one sphingomyelin para masabi natin that the lungs are already mature and that they can already withstand respiration. Kung wala po tayong mature na lungs, if the child is born early or prematurely, ang mangyayari po kapag siya ay humihinga, dahil wala siyang surfactants, pwede pong mag-collapse yung mga alveoli niya, leading also to what we call atelectasis or lung collapse. Okay, so importante po ang surfactant natin for lung maturity. Now, always remember that surfactants begin to form during the 7th month of life or 7th month of intrauterine life. So habang nandun pa siya sa loob ng sinapupunan, nabubuo na po yung surfactants at the month 7. Month number 7 po, the surfactants is developed already by the fetus. This timing is very critical. You have to remember that because adequate surfactant levels are necessary for the newborn to breathe effectively after birth. Kaya nga po, majority sa mga bata po who are born prematurely, they have respiratory difficulty. It is because of the lack of surfactants na na-produce nila dahil nga po sa sila ay maagang naipanganak. So you have to remember that for a child to have no problem when it comes to respiration, they have to be appropriate in their gestational age when they are born, or hindi dapat po sila pinapanganak ng mas maaga, so that we are sure that there is already lung maturity or the presence of 2 lecithin and 1 sphingomyelin in their lungs. Okay? So aside from that, infants born with low levels of surfactants are at a higher risk of respiratory complications, including lung collapse, like I said a while ago, or what we call atelectasis. Now, this condition occurs when the alveoli will collapse, leading to reduced oxygen exchange and then potentially severe respiratory distress. Kaya nga po lahat or karamihan sa mga bata pong pinapanganak na preterm na walang surfactants po ay namamatay sila because of their respiratory collapse dahil nga po sa sila ay walang surfactants. Okay? So, you have to remember na kailangan yung matandaan at maintindihan ang topic on surfactants because understanding the role of surfactant is essential, especially in managing preterm infants. And these babies may be born before sufficient surfactant production has already occurred, placing them at risk of respiratory issues such as neonatal respiratory distress syndrome. Okay? So lagi niyong tatandaan po na may surfactant dapat yung mga bata kapag sila ay ipinapanganak so that there will be no problem when it comes to establishing respiration when they are already born. So ibig sabihin niyan, sir, magtatawag ba kami ng mga pedia doctors when the baby is preterm? Yes. Primarily because these babies are at risk of having respiratory difficulty because of low levels of surfactants in their lungs. Now let us also talk about the gastrointestinal changes in the neonate. Okay? So the gastrointestinal system or the GIT of the newborn is usually sterile at birth, meaning it does not contain any bacteria. Kaya nga po sila ay prone to bleeding because they do not have the intestinal microbiome to synthesize what we call vitamin K. But as the newborn begins to interact with their environment, bacteria already start to enter in their gastrointestinal tract through various routes, like for example, airborne exposure. Lagi niyong tatandaan that bacteria can be inhaled or enter through the mouth of the baby during breathing. Aside from that, pwede ding makakuha ng microbiome yung bata from vaginal exposure during delivery. The newborn is exposed to the mother's vaginal flora, which helps to establish the gut microbiome as well. Aside from that, kapag nakahiga yung bata or when the baby is sleeping and the child has contact with the bedding, bacteria can also be transferred from the bedding materials or other surfaces that the newborn comes in contact with. Aside from that, na-establish din po natin yung gut microbiome through the process of breastfeeding. Breast milk is crucial source of nutrients for the infant, and it also introduces beneficial bacteria to the gut of the baby through the contact of the mouth of the child to the breasts of the mother. Now, sir, bakit po ba magandang i-establish natin yung gut microbiome? Or why is it important for the child's intestines to have intestinal microflora? Importante po itong mga intestinal microflora for the digestion of the child, okay? So the bacteria that are present in the intestines of the child will help break down their food, making it easier for the newborn to absorb nutrients. Aside from that, importante po ang ating gut microbiome para sa ating vitamin K synthesis. Now, certain bacteria in the gut are responsible for synthesizing vitamin K, which is essential for blood clotting and the overall health of the child. Now, you have to remember that although breast milk is the primary source of nutrients for the infant, and sinasabi natin na kompleto na ang breast milk sa mga nutrients, vitamins, and minerals needed by the baby, it is notably deficient in vitamin K. Sadly, mababa po sa vitamin K yung breast milk ng bata. And this is why the vitamin K injections are often given to newborns shortly after birth to ensure that they receive adequate levels of proper blood clotting until their gut flora is already fully developed and they are already able to synthesize their own vitamin K effectively. Okay, so yun po yung dahilan kung bakit kahit nagsususo yung bata or even if the child is breastfeeding, we still give them injections of phytomenadione or vitamin K because the breast milk is deficient of vitamin K. Still on the topic of breastfeeding, marahil nagtataka kayo, Sir, gaano po ba kadami or how much milk do we give the baby during feeding? You have to remember that the stomach of the newborn can hold approximately 60 to 90 ml of food and fluid. Ganun lang po kakonte yung kayang i-hold ng stomach ng bata. This limited capacity means that the infants require frequent feeding to meet their nutritional needs, and that is the reason why we will subject the child to scheduled feeding or subsequent feeding wherein we feed the child every 2 to 3 hours. Why? Because they only have 60 to 90 ml of food and meron lang limited capacity yung kanilang stomach. Okay? You have to also be familiar with the word regurgitation. And when we speak of regurgitation, this occurs when food flows from the back of their stomach to the mouth. Okay? Ibig sabihin, yung stomach po, if it is already full of food or milk, the stomach might regurgitate or may push out some of its content back to the mouth. Always remember that this is a common phenomenon in newborns and is usually due to the immaturity of the lower esophageal sphincter. Dahil nga po sa sphincter ng bata ay hindi pa siya masyadong nag-open at mag-close effectively, nagkakaroon po ng regurgitation yung bata. Okay? So that means that the muscle that controls the opening between the esophagus and the stomach is still immature, which now leads to the presence of regurgitation. Now, when it comes to the pancreas and the liver in newborns produce lower levels of digestive enzymes due to immaturity. Ibig sabihin, yung pancreas hindi pa nakakapag-produce ng insulin and even the liver is not yet producing bile which synthesizes fats. Ibig sabihin, these babies are hard up in digesting mga sugars and fatty foods, kaya nga po hindi pa pwedeng pakainin ng kung anuman yung mga bata when they are still very young because their pancreas and liver are still immature. And that can affect the digestion and absorption of nutrients, which will improve eventually as the infant grows and the organs will already start to mature. Okay? So lagi niyong tatandaan that these factors will contribute to the unique digestive process in newborns, which also emphasizes the importance of appropriate feeding practice and monitoring for gastrointestinal concerns. So pag may nagtanong sa inyo, pwede na bang painumin yung bata ng sugar water? Hindi po pwede because their pancreas does not yet produce insulin and the baby might be hard up in metabolizing or processing these sugars. Okay? So yan yung lagi nyong tatandaan when it comes to the GIT of the neonate. Siyempre, hindi natin pwedeng kaligtaan na pag-usapan yung mga types of stool ng mga bata. Yaman din lamang na napag-uusapan na natin ang gastrointestinal tract of the neonate. Now, sir, bakit pag-aaralan natin yung mga tae ng bata? You have to remember that understanding the types of stool in the newborn is essential for assessing their healthy nutrition and the progression from the meconium to transitional stool and finally the stool of the breastfeed and bottle-fed babies will provide valuable insights into understanding the infant's digestive health and feeding adequacy. So like I said, we have to monitor the stool characteristics because this can also help identify potential health issues early on in the life of the child. So pag-usapan natin yung mga types of stools ng bata. And the first stool that comes out in the baby is what we call the meconium. This is the first stool produced by the neonate, and meconium is considered to be sticky, tar-like, and typically blackish-green in color. And it is typically odorless. So ano yung composition ng meconium? If you ask, meconium is formed from a mixture of mucus, vernix caseosa, lanugo, and undigested carbohydrates that are present during the intrauterine life. Now, lagi niyong tatandaan that the meconium is usually passed within the first 24 hours after birth. Now, if a newborn fails to pass meconium within this time frame, it may indicate a condition such as an imperforate anus or ibig sabihin yung bata baka walang butas sa puwet kaya hindi nakalabas yung tae niya in the first 24 hours. Now, we also have the second type of stool which we call the transitional stool. Ano ba itong transitional stool na to? This type of stool appears greenish like the meconium and also loose and may resemble diarrhea. It is a sign that the infant is already transitioning from meconium to regular stool. Kapag kasi tumae yung bata on the first day ng meconium po, hindi naman lahat-lahat ng meconium sa kanyang intestines ay nakalabas na. There are still meconium remnants or mga residue of meconium in the intestines of the baby, and when the child already starts to drink milk, the stool produced from that milk is combined with the meconium that are residual in the intestines of the child. Now, lagi niyong tatandaan that this transitional stool typically occurs or appears on the second to the third day after birth. And after that, since natanggal na lahat ng mga meconium in the intestines of the child, wala na pong greenish stool. Okay? So after the transitional stool po, there will already be the milk stools of the child. Okay? Yung tinatawag po natin na breastfed babies, they will have breast milk stool, and breastfed babies often pass stool 3 to 4 times a day. Lagi niyong tatandaan po ha, yung mga bata pong sumususo sa gatas ng ina, they pass their stool 3 to 4 times a day. The stool is usually light yellow, it is soft, and it has a sweet smell due to its high lactic acid content. Now, lagi niyong tatandaan that the frequency and consistency of this milk stool indicates that the breast milk is well tolerated and digested. Kaya po siya mabango, kaya po siya mabilis itain ni baby, or that's the reason why the babies will have 3 to 4 times of defecation per day, dahil nga po sa natotolerate ni baby yon, and it is easily digested by the baby. However, when we look at the stool of the bottle-fed babies, they tend to pass stool 2 to 3 times a day lamang. And this stool is typically bright yellow, and they are more formed or mas solid compared to that of the stool of the breastfed infants. It also has a more noticeable odor. So, as compared to the breastfed babies who have aromatic or mga sweet-smelling stool, these babies who are bottle-fed will have stool that have more noticeable in odor. So, mas mabaho po yung tae nila. Now, the differences in their stool appearance and the odor between the breastfed babies and the bottle-fed infants can be attributed to variations in their digestion and also the composition of formulas used. Kaya nga po yung mga bottle-fed babies natin ay 2 times to 3 times a day lang silang tumatae, and that proves that the proteins that are found in formula milk are more difficult to digest, and that's the reason why their stools are harder, and that's the reason why these babies will have less frequent defecation compared to those po na bottle-fed, compared to those who are breast milk fed. Breast milk fed. Wrong. So this is what meconium looks like. It's star-like and greenish in color. Ito naman po yung tinatawag natin na transitional stool, which is a combination of the meconium and the milk stools of the baby. And this is what we call an example of the stool of a breastfed baby, which is bright in color, and it is also passed 3 to 4 times a day, and it is softer with a sweet smell. Ito naman po yung tinatawag natin na stool for bottle-fed babies, and it is usually more formed compared to those babies who are breastfed. Okay, so those are the examples of the stools which we have discussed a while ago. What we have discussed a while ago are those stools we consider to be normal, okay? But there are also some stools that may deviate from what was presented a while ago. And we need to be vigilant in assessing these stools because they can help us determine the condition of our pediatric clients. Now, monitoring the color, consistency of a newborn stool is crucial for early detection of potential health issues that are present in the baby. And variations in stool appearances can also provide clues about the infant's digestive health, feeding tolerance, and even possible underlying conditions that may require medical attention. So, pag-usapan natin yung mga abnormal na stools na nakikita natin sa mga bata. And the first one is what we call stool in babies under phototherapy. So, infants who are undergoing phototherapy can pass bright green stools. And ano yung cause kung bakit sila merong bright green stool? You have to remember that this change is due to increased in their bilirubin secretion as the phototherapy will help to break down the excess bilirubin in their blood. Aside from that, makakakita din tayo ng mga babies with milk allergy, and the characteristics of their stool will be, it is stool that is mixed with mucus. Okay, babies with milk allergy may produce stools that are mixed with mucus, and ano yung cause nito? This can be indicative of lactose intolerance, wherein the baby's digestive system has a difficulty processing lactose in the milk that they drink, and kaya po sila may mucus sa kanilang stools. We also have gray-colored stools, and when you see gray-colored stools, this is caused by bile duct obstruction, meaning the bile cannot enter the intestinal tract to metabolize the fats properly. Kaya yung tae ng bata ay nagiging gray lang in color. We also have what we call black tarry stools, and this should raise suspicion. Kasi nga po, hindi natin gustong makita ang black tarry stool after the first 24 hours of life of the child. Kasi yung meconium po, yun yung black na color ng bata, blackish to greenish stool of the child. But if you see black tarry stool during the later parts of delivery of the baby, they may already suggest internal bleeding, which could be also caused by swallowed maternal blood, especially if it occurs on the second day or later after birth. Okay? Meron din po tayong tinatawag na blood flecked stool. Ang blood flecked stool po natin may indicate an actual issue in the gastrointestinal tract, and this condition is often associated with anal fissure or nagkasugat po yung puwet ng bata, which can occur due to the passage of a hard stool or trauma in the anal area. So yung bata po kapag may impacted stool or sobrang tigas ng tae niya, and if the child forces to remove or excrete this impacted stool, pwede pong magkasugat yung kanyang puwet, leading to what we call anal fissure, which will in turn lead to blood-flecked stool. So tignan natin yung mga itsura. This is the stool of the child under phototherapy, and it is because of the increased bilirubin level in their excreta or feces, kaya po siya nagkakaroon ng color green and loose na stool. We also have this one. This is a stool of a child with milk allergy because they cannot effectively eliminate or process the lactose present in the milk. Kaya po may mucus yung kanilang tae. We also have this gray-colored stool, and this may be because of bile duct obstruction, kaya po hindi nakakapasok yung bile sa intestines, and that will now lead to the gray color of the stool instead of the color yellow that is usually seen in our patients. This is an example of a black tarry stool, typically seen in patients with internal bleeding. Kaya po yung pasyente, kapag meron siyang internal bleeding or meron siyang suspected dengue, you have to report this black tarry stool immediately. But if the black tarry stool is seen on the second to the third day of life, kahit hindi nyo na po muna i-report ito because this may be due to the swallowed blood of the child during vaginal delivery. So may mga na-swallow siya na blood from the vaginal birth, and then when this is being excreted by the body, yung feces po ng bata nagkakaroon ng black tarry appearance. And lastly, this is an example of a blood-flecked stool. It may be because of anal fissure. When a child is constipated, nagkakasugat yung puwet, thereby meron po siyang sugat sa kanyang tae. Let us also learn about the urinary system changes that occur during the neonatal period. As nurses and midwives or healthcare providers in the future, we also need to monitor the status of our patient's urination. Bakit po? Because careful observation of urinary patterns and characteristics in newborns is crucial for early detection of possible urinary tract abnormalities and even dehydration. So we have to do regular assessments which will help ensure that any potential complications are identified and managed promptly and early on in life. Now, pag-usapan natin yung initial voiding or yung unang pag-ihi ng bata. Newborns typically void or urinate within the first 24 hours after birth. Monitoring this is essential for assessing urinary function. Dapat po, tinetake na yun ng notes and you write it on your nurse's note if the child already starts to micturate or urinate on the first 24 hours of life. Bakit? Because we want to determine the presence of anuria. And when we speak of anuria, this is the absence of urine or anuria. Walang ihi yung bata on the first 24 hours, and this can occur due to decreased fluid intake. Now, it is important to check for possible causes of anuria, such as stenosis, or the narrowing of the ureters of the child, or you also have to check for the absence of ureters, as this condition may impede the urine flow, leading to anuria. Now, you also have to observe the urinary stream of our patients. Pag mga lalaki po, tignan natin yung kanilang projection ng kanilang ihi. Now, for normal neonates, they have a small projected urinary stream. Ibig sabihin, may konting stream lang po na makikita pag sila ay umiihi. But for abnormal findings in the urinary stream of these male patients, there is a strong arcing projection, and that can indicate urinary tract obstruction. Baka po may bara, kaya malakas yung stream ng pag-ihi ng bata. For females naman po, the normal urinary stream for females is a steady urine stream. Okay? But for abnormal po, abnormal assessment natin, there is continuous dribbling or yung parang diretso siyang may pumapatak-patak, which may suggest an underlying health issue. Now, titignan din natin yung characteristics ng urine ng ating mga pasyente. We will also look at their color, titignan din natin yung kanilang amount para ma-determine natin if there is abnormality. Now, newborn urine is typically light in color because their kidneys are not yet fully developed and that they cannot yet concentrate urine effectively. Pero as time goes by and that the kidneys already starts to mature, yung bata po magkaka-color na yung kanyang ihi because they can already filter the blood and remove these mga excess metabolites in the body through the urine. Now, the normal urine output for the first 2 days, the expected urine output is approximately 30 to 60 ml per hour. And monitoring the urine output can help us identify for potential presence of dehydration or mga renal problems ng bata. So you have to remember po no, na every hour there is only 30 to 60 ml of urine produced by the kid or the pediatric patient. So this is the urinary stream for normal male patients. Yung adult po, yan yung normal dapat. It's just a small arcing projection. Pero pag abnormal naman po, there is a strong arcing projection which is typically seen in patients with urinary obstruction. For females naman po, it is just a steady stream, parang ganyan lang, gripo dapat na lumalabas siya. But for abnormal findings po natin, there is continuous dribbling or diretsong pumapatak-patak yung ihi ng bata, which will already be a signal for a possible renal problem. Let us also study the autoimmune system of the neonates. The neonatal immune system relies heavily on maternal antibodies and colostrum for initial protection against infection. Lagi niyong tatandaan that during the first 2 months of life, the child is prone to infection and they just rely on the protection from the antibodies given by the mother through the placenta and also the colostrum or the first breast milk produced by the mother, which is also rich in immunoglobulin. Because during this time, habang bata pa yung mga bata, they cannot yet produce their own antibodies. So as future nurses and midwives, it is important that you understand the weakness in the autoimmune system of your pediatric patients so that you will appreciate the importance of timely vaccination and even breastfeeding to support the newborn's immune developments and their overall health during the early stages of their life. Now, pag-usapan natin yung immune development ng mga patients natin. Newborns face challenges in forming their own antibodies against infection, like I said, for the first 2 months of life. And this underscores the importance of vaccination and the protective benefits of colostrum. Dapat po yung mga bata ay pinapasuso natin so that they can receive the immunoglobulins from the breast milk of the mother. Now, we have what we call the maternal antibodies or what we call the IgG, and newborns receive these IgG antibodies from their mothers, which cross the placenta during pregnancy. And these antibodies are important because they provide temporary immunity against certain infections, and they will also help to protect the newborn in the early weeks of life. We also have colostrum. Ang colostrum naman po is the first milk produced by the mother, and it is a clear, light yellow fluid that is rich in antibodies. And this early milk is crucial for the newborn's immune defense, which offers essential nutrients and immunological support to help the infant combat infection. So lagi niyong tatandaan po no, na ito po yung dalawang protection ng mga bata during their neonatal period or the first days of life. As time goes by, the child will already develop their own immunity and also acquire immunity from different sources such as vaccination. And as future healthcare providers, it is important that you understand these types of immunity because it is essential for you to comprehend how the body defends itself against infection. And each type of immunity plays a crucial role in protecting the health of the child, especially yung mga vulnerable populations natin like newborns who heavily rely on maternal antibodies and vaccination for their immunity. So pag-usapan natin yung mga types of immunity. The first one is what we call the natural or innate immunity. And this immunity is inherited and present at birth. It includes physical and chemical barriers such as skin and mucous membrane, along with immune cells that respond to pathogens. So ito pong natural immunity natin, they provide immediate defense against a wide range of invaders without requiring prior exposure. Meron din po tayong tinatawag na artificial immunity. And this type of immunity is acquired through intentional exposure to antigen, typically via vaccination or even immunoglobulin therapy. And it can be categorized into two types, pwede siyang active or passive immunity. Okay? So meron po tayong tinatawag na active immunity and passive immunity. Active immunity occurs when the body is exposed to a disease-causing pathogen and produces its own antibodies in response. And this can happen naturally through infection or artificial vaccination. So, active immunity ang tawag natin kung ikaw mismo yung gumawa ng immunoglobulins mo sa katawan after exposure to a certain disease or after vaccination. So, kung ikaw yung gumawa ng bakuna or ng immunity na yon, that means that that is active immunity. Now, active immunity is long-lasting and the body retains memory cells that are capable of responding to future exposures to the same pathogen. Meron din po tayong tinatawag na passive immunity. And when we speak of passive immunity, it involves the transfer of preformed antibodies from one individual to the other, providing immediate but temporary protection. For instance po, no, yung maternal antibodies na ginawa ng nanay. The maternal antibodies can be transferred to the fetus through the placenta, or they can also be transferred from the breast milk to the baby via colostrum. So dito po, yung mother yung gumawa ng antibody na yon. But you just received that protection through the transfer of these immunoglobulins. So ang tawag po natin dyan is passive immunity. Unlike active immunity, passive immunity does not engage the host's immune response or immune system in producing its own antibodies. So lagi niyong tatandaan yun ha, pag natural or innate, ginawa ng katawan or natural po na ginagawa ng katawan natin. And for artificial immunity, ito po yung mga na-manufacture or na-develop sa mga laboratories produced by scientists. Ito po yung mga artificial immunity. When we speak of active immunity naman po, your body creates this antibodies on their own through prior exposure to vaccines or mga pathogens or mga sakit. And yung passive immunity naman po, ginawa ng iba, pero ibibigay nila sa'yo, you just received that immunity, tawag po natin doon, is passive immunity. Now, let's discuss further the types of immunity. Meron tayong tinatawag na natural active immunity, and this type of immunity develops after exposure to a pathogen, such as when an individual contracts chickenpox, and the individual will produce their own antibodies against the chickenpox. Tawag po natin doon is natural active. Na-expose ka, nagkasakit ka, nilabanan ng katawan mo yung sakit na yon, now you became immune to that disease. Tawag natin doon, natural active immunity. Meron din po tayong tinatawag na natural passive immunity. And this type is acquired naturally through the transfer of antibodies from the mother to the child. So dito po, either the placenta transfers the immunity to the baby during pregnancy, or yung colostrum po na ginawa ng nanay, nilipat niya yung kanyang immunoglobulin sa bata, and yung bata becomes protected because of what we call the natural passive immunity. Iba yung gumawa, pero ikaw yung nakinabang sa immunity na yon. We also have what we call the artificial active immunity. And this immunity is achieved through vaccination such as the measles vaccine, which will stimulate the body's immune system to produce antibodies against specific pathogens. So anong nangyari? Sa vaccine po kasi, meron po siyang attenuated microorganisms or those microorganisms that have been removed from their pathogenic effects. Okay? So pag tinurok po yung microorganism na yon through vaccination, your body develops fever, and na-trigger or na-stimulate po yung immune response, and then you will produce your antibodies against the pathogen na binakuna sa inyo or yung antigen na binakuna sa iyo, and because of that, you will be protected from that disease already. Meron din po tayong tinatawag na artificial passive, and this type involves the administration of antibodies from external sources such as anti-serums or anti-rabies treatments, which will provide immediate but temporary protection. So kunwari, ikaw ay nakagat po ng aso, you will not need to produce your own antibodies po against the rhabdovirus kasi nga po, meron po tayong artificial passive source na i-inject na lang sa'yo like for your anti-rabies po for the body to help kill the rhabdovirus. So yun po yung example natin ng ating artificial passive. Hindi po gagawa yung katawan natin ng immunity against that virus or bacteria, bagkus i-inject po lamang yon yung ating pong mga active na immunoglobulins against those diseases. Our last topic for this video is the senses of the neonates. Okay? You have to remember that in neonates, different senses develop at varying rates. Kung naaalala nyo pa yung principle of asynchronous growth and development, which means that not all body parts develop and grow at once. So may mga senses po yung neonates that are far more advanced compared to the other senses. So yung pinaka-developed or pinaka-advanced po na sense ng bata is the sense of touch. Newborns have a well-developed sense of touch and they can feel and respond to different textures, temperatures, and nafe-feel na din nila yung mga different pressures during in their skin. This sense, the sense of touch, is crucial for bonding, and it will help in the physical and emotional development of the child. They also have a sensitive skin, and they can respond to gentle touches, which can be soothing and comforting. So yan pong touch ang pinaka well-developed na sense ng bata. Ang susunod po is the sense of smell. Newborns already have a functional sense of smell, and they can already detect and respond to different odors. Nakakaamoy na po yung bata, which will help them recognize their mother's scent, and they can also influence their feeding behavior. Kasi sa maniwala at kayo at sa hindi, the child can already also smell the breast milk of the mother. Kaya po natutulungan ito na mahanap ng bata yung kanyang sense of smell po. Okay? They are particularly also sensitive to smell of their caregiver and the breast milk of the mother. So that is a proof that the sense of smell of the child is also well developed at birth. When it comes to the sense of taste is quite developed in neonates already. And these neonates can already distinguish between sweet, sour, bitter, and even salty flavors. For example, they have a preference for sweet tastes, which is thought to be a natural inclination since the breast milk is sweet. Kaya nga po, as much as possible, hindi po natin binibigyan ng formula milk yung mga bata before giving them the breast milk. Bakit? Because these babies like sweet tasting foods. And if you give them formula milk first before breast milk, mas masasanay sila sa lasa ng gatas na yon. Thereby, they will not like breast milk any longer. That is a proof that the sense of taste is already developed at birth. Now, when it comes to hearing, while newborns can hear and respond to sounds, their auditory system is still developing. Ibig sabihin, hindi po ganun ka-develop yung sense of hearing ng mga bata. Their auditory system, like I said, is still developing, and they can recognize their mother's voice and other familiar sounds, and newborns may startle or magugulat sila at loud noises, and they are attracted to rhythmic sounds during this time. However, kaya ko sinabi na hindi pa siya ganun ka-develop yung kanyang sense of hearing is because their ability to localize the sound and fully interpret the complex auditory information means na hindi pa nila kaya itong gawin. Kunwari, may naririnig siya, but unlike us that we can geolocate where the sound comes from, alam natin galing siya sa left or galing siya sa right, sa mga bata po na bagong panganak, they cannot yet properly locate or process information na kanilang mga naririnig. That is also a proof that hearing is already present, although it is still immature or underdeveloped. The most underdeveloped sense of the baby is vision or sight. Okay? Vision is the least developed sense at birth, and newborns are born with blurry vision and can see best at close distances only. So nakakakita lang sila up to 8 to 12 inches away from their eyes. And they are more sensitive to light and can focus on high contrast patterns like nakikita lang nila ay black and white, ganon, or color red, yun lang yung nakikita nila. But over the first few months, hanggang 4 months po yung bata, their visual acuity will already start to improve, and they can gradually begin to track moving objects, and they will already start to recognize faces after 4 months and see a wide range of colors. So nag-i-improve lang po yung mata ng bata, yung kanyang visual acuity after the age of 4 months, but at birth, these patients cannot yet properly see. So meaning vision is the least developed sense in the newborn. And that ends our recorded lecture for the topic Concepts on Pediatrics, where we reviewed the systems of the neonates. We talked about the blood values, respiratory system, gastrointestinal system, even the urinary system, and the autoimmune system of the neonate. And we also talked about the different senses of the neonate. Sana po ay marami kayong natutunan sa akin, and I hope that you enjoyed our session together. Maraming salamat for listening, and enjoy the rest of the day.